So hello everyone, our today's topic is the introduction to the orthodontics. So first of all, you should know orthodontics. It is a branch of dentistry that focus on diagnosis, prevention, and the treatment of dental and facial irregularities, primarily concerned with the alignment of teeth and the jaws. Now let us discuss the introduction to the orthodontics. Who who coined the term orthodontia? It was Lee Folon. In the term orthodontia, it was coined by the Lee Folon in France in 1839. So remember, James Murray, he suggested that he suggested the term orthodontia should be changed to the orthodontics. The term orthopedics was first used by Bonon. The Devil suggested that the dentofacial orthopedics. So he suggested the term dentofacial orthopedics. The Talma used the term orthodontics and dental orthopedics. In 1985, the American Dental Association, they recognized the specialty of orthodontics and officially titled it orthodontics and dentofacial orthopedics. So the orthodontics, it is a branch of dentistry that is concerned with the prevention, interception and correction of the malocclusion. The orthodontics term, it has a Greek origin. So it is derived from two words, orthos that means correct and odontos means the teeth. So when you combine these Greek words, orthodontics literally means correcting teeth. Now what are the services that are offered by the orthodontics? The orthodontics offer a range of services aimed at addressing the various aspects of dental and facial irregularities. So these services are preventive orthodontics, interceptive, corrective and surgical orthodontics. The first is the preventive orthodontics. So the principle of preventive orthodontics is that prevention, it is always better than cure. So these procedures, they are performed before the onset of malocclusion. So here the goal is to take action that preserve the integrity of what appears to be normal for person age. So here it may include the techniques to guide the eruption of permanent teeth, correct the harmful oral habits, and monitor the growth of development of dentofacial region. So, preventive orthodontics, it is a set of action taken to maintain a healthy and normal alignment of teeth and facial structure. So, it will include number one, assessment of normal development. So, understanding how teeth and face grow normally and recognizing when there are deviation from this normal growth. Eliminating the harmful habits, like correcting the behavior or habit that can negatively impact the dental and facial structure. The contributory factors, like dealing with factors like posture, nutrition, that may contribute to the alignment issues. Tooth restoration, restoring the individual tooth to maintain their proper form and function. Ensuring that the deciduous teeth, they are shed at the right time to make way for the permanent teeth, and using the space maintainer. So when necessary, in order to preserve the space in mouth, when the deciduous teeth are lost prematurely, space maintainer that could be given, that are all covered in preventive orthodontics. The second is interceptive orthodontics. The interceptive orthodontics include the procedure that are initiated at early stage of malocclusion to eliminate or reduce its severity. So interceptive orthodontics, it is a phase of orthodontics that is mainly focusing on the recognizing and addressing the potential irregularities and misalignment in the developing dentofacial complex. Unlike the preventive orthodontics that aims to prevent the occurrence of malocclusion, interceptive orthodontics acknowledges the existence of developing malocclusion and works to eliminate or reduce its severity. So, what are the key measures and action in the interceptive orthodontics? That includes number one is the caries control, managing and preventing the dental cavities. It is essential to maintain good oral health and reduce the risk of malocclusion by the tooth decay. Second is anatomical dental restorations, restoring the anatomical structure of teeth through procedures such as fillings and crown to ensure proper alignment and function. Transitory oral habits, addressing the habits like thumb sucking or tongue thrusting which can contribute to malocclusion. Genetical and congenital anomalies, addressing the genital or congenital anomalies that may affect the dental and facial structures. Supervising the exfoliation of the deciduous teeth so that the permanent teeth can erupt. Third is the corrective orthodontics. So it is corrective orthodontics is undertaken when a fully established malocclusion is present. So this branch of orthodontics acknowledges the existence of malocclusion and it aims to reduce or eliminate the problem. The corrective orthodontics include the use of braces, aligners, and other orthodontic appliances that are used to reposition and realign the tooth and jaw in their correct position. The other is the surgical orthodontics. It is also known as orthognathic surgery. So that means that involves the surgical procedure carried out in conjugation with the ortho treatment. So it is used to address severe dentofacial deformities that cannot be corrected through the orthodontics alone. Now, what is the aim of ortho treatment? The aim and objective of orthodontic therapy have been summarized by Jackson as the Jackson triad. So what are the three main objectives of orthodontic treatment? These are the functional efficiency, structural balance, and aesthetic harmony. These are the three main objectives of orthodontic treatment. So remember, for your entrance exam, the functional efficiency, the orthodontic treatment, it aims to improve the efficiency of the function performed by the teeth, jaws, and associated structures. So these functions would include biting, chewing, speaking, and the overall health. The second is the aesthetic harmony. It is a significant aim of orthodontic treatment, and it strives to enhance the overall appearance of an individual. So achieving aesthetic harmony, it involves the aligning specific teeth, repositioning the entire jaw, or adjusting the basal bone structure in order to create a more pleasing appearance. So the result are aligned to make the person more aesthetically pleasing. Other is the structural balance. Ortho treatment not only address the alignment of teeth but also consider the surrounding soft and skeleton tissue. So it is essential to maintain a balance between these structures. so that the correction of one aspect does not harm the health of other. So these are the three main objectives of the orthodontic treatment as per Jackson triad. Let us discuss a brief history of the orthodontics. Remember that Pierre Fauchard, he is known as father of modern dentistry. So he developed the first orthodontic appliance that is known as bandlet. That was designed for arch expansion. Other is John Hunter. He was a renowned teacher of anatomy. He demonstrated the growth, development, and articulation of maxilla and mandible along the attached musculature. He coined the nomenclature of the teeth. Other important point that you have to remember is the first dental college. For your entrance exam, remember that the first dental college in the world, it opened its door to class of 5 students on November 3rd, 1840, and the college was Baltimore College of Dental Surgery. Other thing that you have to remember is Emerson C. Engel. He pioneered the use of jack screw type of device for the maxillary expansion. In 14-year-old girl achieving a significant increase in the arch width. William McGill, he was first person to bend teeth for active movement in orthodontics. Other thing that you have to remember is Chapin Harris. He introduced the concept that the orthodontic tooth movement, it is result of bone resorption on one side and bone deposition on the other side. So pressure tension theory was given by Harris. Other was Kingsley. So he conducted experiment with the orthodontic appliance. He fabricated obturator for cleft palate patient. He also introduced the jumping bite concept. A forerunner of the modern functional appliances. He also pioneered the use of headgear to apply the extraoral forces and provide anchorage at the occipital region. Other is John Farrar. John Nutting Farrar. He is known as father of American orthodontics. So he laid down the theory of intermittent forces. He was first to recommend the root or bodily movement of teeth during the ortho treatment. Whereas Edward Engel, He is known to be father of modern orthodontics. So he did his DDS, remember, from Penny, Pennsylvania College in 1878. He developed angle postulates, which are foundation principle in orthodontics. He stated that the upper first molars, they are the key to occlusion and most stable landmark in the craniofacial anatomy. He also stated the upper and lower molar should be related so that the mesiobuccal cusp of the upper molar it includes in the buccal groove of the lower molar. So he established orthodontics as a separate branch of dentistry. He also classified malocclusion in year 1899. He established American Society of Orthodontics in year 1901. He developed various orthodontic appliances that becomes functional in the field. The E-Arch appliance in 1907, the pin and tube appliance in 1912, the ribbon arch appliance in 1915. Other was the Kelvin S case. He was first to attempt the bodily tooth movement. He pioneered the use of retainers, fabricated obturators. Other was Marty Dewey. So he is known for modifying the angle classification of malocclusion. He modified uh, the angle classification of malocclusion. He founded the Dewey School of Orthodontia in 1911. He studied under the angle and returned to Australia. Initially used the non-extraction methods and the ribbon arc mechanics. He later introduced the extraction method and further developed the ribbon arch appliance. Charles Tweed, he applied to the Angle School and worked closely with the Angle for last 2 years of Angle's life. He pioneered the use of edgewise arch mechanism. The Philip Adam, he modified the arrowhead clasp by the Schwartz into Adam Cribb. Anderson, remember, introduced the activator. Bimler, remember, he created the myodynamic appliance. Frankler, remember, from Germany, he introduced the functional regulator. Remember, Lawrence Andrew, He is known as father of pre-adjusted bracket system, and he introduced the six keys of occlusion. Charles Burstone, he contributed to orthodontics with segmented arch technique and introduced materials like TMA was Chinese night eye and fiber reinforced composite. It was introduced by Burstone. The Graeber, he authored 20 textbooks and contributed 22 chapters to other textbooks, published 180 articles in journals. So in 1950, he became a first dentist to earn a PhD from the Northwest University Medical School. The Clark, remember, he developed the twin block technique, so which has become one of the most widely used functional technique in orthodontics. The Herbst, remember, he gave the Herbst appliance along with the Punchledge. The Ricketts, remember, he introduced the concept of bioprogressive therapy and aimed at improving facial aesthetic and functional. Pioneered the use of visual treatment objective.